The next time. Resuming debate, the Honourable Member for Esquimalt, Saanich Sooke.
Thank you very much, Mr. Speaker. I'm pleased to rise today to speak of my party's Opposition Day motion on Pharmacare, but I have to say my 20-something self would be somewhat perplexed that I'm actually doing this. Not just to think that as a gay man I might be an MP, but also astounded that we still haven't finished Tommy Douglas's dream. His dream of comprehensive, public, free health care. Well, strangely, we've kind of convinced ourselves we already have that. We seem somehow to be turning a blind eye to the gaps in that system. Now, Tommy always thought it would be a step-by-step process, but that eventually we would get there. And I think we have to ask ourselves how we've convinced ourselves for so long that pharmacare and dental care shouldn't become part of our comprehensive public health care system. So I'm very pleased to sit in an NDP caucus led by the member for Burnaby South and by the member for Vancouver Kingsway on this important question of how do we advance toward that goal that Tommy set so many years ago. It's a caucus which has put forward clear and achievable plans to fill those gaps. When the Liberals proposed a tax cut, the so-called middle-class tax cut, last December, we proposed in return that we limit the benefits of those cuts to those earning less than $90,000. And with the savings from limiting that tax cut's benefits to the rich, we could in turn finance a dental care program for everyone earning less than $90,000 a year. So there's a practical step we could take and a way to pay for it, and one that's clearly within our means and clearly doable. So I'm hoping after we debate pharmacare, we'll move to that next stage of debating dental care in this Parliament. Now, as promised by our leader, our first private member's bill is going to be brought before the House here will be the member for New Westminster Burnaby's Bill C-213. This lays out a specific plan for pharmacare based on the principles of Medicare. So once again, a program which is universal, comprehensive, accessible, portable, and public administered. So I guess I'd have to say also my 20-something self would be perplexed about, again, why we don't already have this. Tommy Douglas, when he set out his dream first in the provincial campaign in 1960 in Saskatchewan, he knew it would be difficult. He knew it would be step by step. But in 1962, when he tried to add doctor's visits onto the existing hospital insurance plan, he had to face down a 23-day doctor's strike. So we know there will always be people who will step forward, who will say there are so many reasons why we shouldn't take the path that we know is the right path. In 1965, BC joined Saskatchewan with a hospital and doctor visit insurance plan. And then in 1966, in Pearson's second minority government, we had a federal government that finally offered financial assistances to provinces which had such a universal plan. And sure enough, within 10 years, we had public health care plans established in every province across the country. Now, when Tommy moved to the federal level, he brought his dream with him. In 1961, he became the leader of the newly established NDP, and in its first platform, the NDP put forward specifically the proposal to have a pharmacare program on the same principles as a Medicare program. Unfortunately, it's taken us a bit longer than I think Tommy thought it would to get an NDP federal government. I know that because in his last term, I had the great privilege of having Tommy as my MP. So along the way, there were other reasons to be optimistic about pharmacare. I guess I would have to admit that. First of all, as previous members have mentioned, we've had numerous commissions, advisory councils, studies dating back 60 years, probably to the first one that I saw, recommending a universal pharmacare program. And so one would think we would get to this. And of course, skipping over all that time, last June we had the Hoskins report. This Liberal government's own appointee, a Liberal from Ontario, who sat down and worked through all of the issues and ended up recommending, guess what, just the same thing that we've all known we needed, according to the 5 principles of the Canada Health Act, and something that he judged we could implement by the 1st of January 2022. So perhaps today's motion is the first step toward that date, January 1st, 2022. I really hope it is. I'm encouraged by the things I've heard from previous Liberal speakers that they are going to support this motion because this motion commits this House to move forward on pharmacare. It's not just an expression of opinion, as Opposition Day motions sometimes are. It's a commitment if it's passed by the majority, that we will actually do something to get Pharmacare in place. And I would hope that action will occur quickly. And of course, the NDP has offered that opportunity with our private members bill. However, we wouldn't be disappointed if the government introduced a bill even before that and decided to move it through expeditiously as a government bill. I'm not seeing that happen, but maybe today, maybe this opposition motion marks a change in direction toward finally getting this done. Now, let me talk for a moment about why we should be doing universal pharmacare. And in doing so, I could talk about savings to the healthcare system. The Hoskins report was very clear that the overall expenditures on prescription drugs in this country would drop by about $5 billion a year. This would come from a number of sources. One is, of course, we'd get the ability to negotiate lower prices for drugs through strategies like bulk buying of drugs, through increased generic substitutions, and of course also from eliminating the administrative costs. And for those in this House who like to go on about bureaucracy, let's look at this patchwork system we have across the country with literally more than 1,000 healthcare plans all being administered to accomplish the same purpose. So the Hoskins report was very clear about the savings overall to the system if we adopted a universal, comprehensive, and publicly delivered pharmacare program. I could talk about the savings that would come to the healthcare system through better health outcomes. This goes beyond that $5 billion. What it really means is if we remove the barrier of cost to people actually getting the treatment they need in terms of prescription drugs, they're going to be healthier. And what does that do? That reduces the stress on our already overburdened healthcare system. This means that we could do more with the same resources we have now if we don't have people who end up in the emergency room, who end up in the hospital, who end up ill because they couldn't afford their prescription drugs. So that's an additional savings that won't show up in dollars. It'll show up in less stress on the dollars we're already devoting to our healthcare system. Now, I could also talk about savings to business, and this may be a strange one for some people to think about, but there'd be important savings to businesses here from adopting this kind of national comprehensive program. Right now, businesses and their employees jointly spend about $16.6 billion in expenditures on drug plans, right? So what happens to that money? That money takes cost away from away from business and their employees and transfers it over to be shared by all of us through the taxation system. So it would reduce the business burden they have to carry. But also, and here's where I'm going to be an advocate for small business again, a comprehensive universal plan like this would help level the playing field for employment in small business. Lots of small businesses tell me they have trouble getting the high-skilled help they need because the scale of their operations just isn't big enough for them to offer a good drug plan. And so if we have a comprehensive public plan, that means small business can compete with the big companies who already have those benefit plans when it comes to hiring employees. And you can understand why somebody who might prefer a small business in their local community where they were from, but has to think about their family when it comes to drug protection, and maybe choose their second choice as an employer and go with a big company because of the drug plan that's offered and the safety and security that would appear to offer to their family. So an important benefit for small business by this leveling of the playing field when it comes to prescription drugs. Now, I could also talk about equity. A good reason for a national pharmacare program, which is comprehensive and universal, is this patchwork you've got now means that the treatment you get in Canada depends on which province you live in, who's your employer, or how big is your wallet. And that's certainly something that I, as a Canadian, don't believe is what we aspire to in this country when it comes to the health of our citizens. Now, let me turn, as I know the clock's ticking away here. The real reason I believe we should have a public universal program for pharmacare is its impact on ordinary families. And let me take a minute to talk about what this really means in everyday situations. 1 in 5 Canadian households report a family member who in the past year has not taken their prescribed medicine due to its cost. This means more sick days in families, and this means, in many cases, earlier deaths in families because people weren't taking their proper prescriptions. More than 3 million Canadians per year report they're unable to afford one or more of their prescription drugs. Same outcomes. Bad for families, bad for their health, bad for the healthcare system. Almost 1 million Canadians reported each year they cut back on food or home heating in order to pay for their medication. This is a cruel choice that we're forcing on Canadians who don't have prescription drug coverage. And finally, Canadian adults are 2 to 5 times more likely to report skipping their prescriptions than those who live in a system which already has a comprehensive and universal public program. So, Mr. Speaker, I know we're drawing to a close. I would say here in 2020, we're at a historic moment. The Liberals have a minority government. We got healthcare, universal healthcare, through a Liberal minority government. Well, here's another opportunity to move forward. We in the New Democratic Party have presented proposals consistent with the Hoskins report, which will help us get a detailed plan in place. So today, we have the motion from the member for Vancouver Kingsway before us, which will commit us to move forward to where we all want to go in this country. Thank you, Mr. Speaker.
Question.